My student ID is DLPD2403, and I will be introducing our country, which is the Central African Republic. The Central African Republic is located in the heart of Africa, and it was colonized by France in the late 19th century. It gained independence in 1960s, and since the 2000s, it has been plagued by recurrent armed conflicts, and today it remains as one of the world's poorest nations, which is heavily reliant on humanitarian aid and international peacekeeping forces. It is a landlocked country, and historically being landlocked, this disadvantages to a country's development. It cuts off a nation from important resources and it prevents direct access to maritime trade. So that makes them heavily dependent on their neighboring countries in order to import and export goods. The most recent health indicators the Central Republic of Africa has is one of the lowest life expectancies alive at birth at 54 years old and a health of 45 years old, which puts them below global averages according to the World Health Organization. It has one of the world's highest maternal and child mortality rates and a significant rise in gender-based violence cases with 11,000 incidents reported in the first half of 2023 alone. Their healthcare system faces challenges due to the decades of conflict, which have led to a scarcity of healthcare professionals and facilities. Many health centers lack essential medicines and equipment, and ongoing insecurity hampers the delivery of medical supplies. Their weak disease surveillance systems contribute to the rapid disease of communicable diseases.
Hi, my name is Jun Yu, RYUJD2103, and I will introduce you cause of deaths and DALIs in the CAR. For the graph on the left side, we can see top causes of death for adults, and on the right side, we can see birth and kids-related death causes. For adults, first leading death cause is TB, known as tuberculosis. Second leading cause is lower respiratory infections. Third and fourth are malaria and HIV. Now let's move on to the birth and kids-related mortality. Comparing data between CAR, global, and USA, it is clear the maternal under 5 and neonatal mortality, all of them are significantly higher, but also extremely higher when we compare one-to-one to the US, as an example of high-income country. Now let's make a calculation for DALI, which is a great tool to measure burden of diseases. Now, this is the data we're going to use as an estimation, and some of the data are based on realistic estimates to calculate. Now, this is a brief DALI data, and we can see we can get 1.13 million DALIs. And do not forget, we ignored other factors. We only used 4 major diseases. What about others? Let's compare with group levels. This circle graph shows a cause of death by group level 1, 2, or 3, and the rest. We are able to see the group 1 diseases are dominant cause of death. Therefore, we will take attention and talk about group 1 diseases.
Hello, my name is Tilmak Dawasurun and my student ID is DAVTD2501. Now I'm going to talk about 3 public issues of Central African Republic, which are tuberculosis, malaria, HIV, and AIDS. So in 2021, incidence rate of malaria was 334 per thousand, which is relatively high and off track for global technical strategy for malaria. And Central African Republic is one of the countries that most affected by tuberculosis infection, with incidence of 540 per 100,000, with mortality rate of 91 per 100,000. Furthermore, the most important problems are Central African Republic has recent rate of case of multi-drug resistant tuberculosis by 850% in 10 years, starting from 0.4% to 3.8% from 2011 to 2021.
Hello, my name is LingHan, SHEL1D2043. Let me share with you the risk factors of the 3 diseases. The first disease is tuberculosis. HIV infection is one of the strongest risk factors, weakens the immune system, making it easier for tuberculosis to develop. Close contacts with tuberculosis patients, especially in households or crowded living conditions, is weakened the immune system due to conditions like diabetes, cancer, malnutrition, or medications. Most vulnerable populations include people living with HIV, close contacts of individuals with active tuberculosis, children under 5 years old, elderly individuals, people in low-income or undeserved communities. The second disease is malaria. The three risk factors include geographic location, climate, and season, lack of preventive measures. Most vulnerable populations include children under 5 years old, pregnant women, and people living in or near endemic area. The third disease is HIV. The risk factors include unprotected sex, multiple sexual partners, and sharing needles. The most vulnerable populations included men who have sex with men, people who inject drugs, and sex workers. Thank you.
Okay, here's my part. My name is LingHan Gao, GAOLD 2403. And the first issue is TB. As we can see in left side graph is gonna the number of the induction of TB is gonna much more higher than higher. It's kind of like racing for 2002 to 2022. Here's the detection rates. How can we get this number? We use the estimate number of new TB to over by the report new and current TB cases times to 100 that we get the number for detection rates. Here is the incidence of TB per 100,000. It's like kind of a remain for 540 people get TB. So here is the intervention about how to prevent the TB. And the first one is we can active case finding, and second we can contact the investigation, and the third one is observation and cure and use some drug to deal with it. That's issue for TB. And we can also cooperate with the international organization, which we can operate with the WHO, MSF, and we can also give them health education and publicity. Here's our action plan. We wanna our key goal is to reduce the TB incidence rate by 20% over by 5 year after 5 years, and also achievement the treatment rates of 85%. Here our key action, what we do, and of course it's a 5 year plan. The first year is a planning, and the second year is implementation, and the last 5 years is evaluation. And here's our resources need. We use like around like $5 million over 5 years. Here our human resources we need. The second issue is malaria. Here is malaria in CAR for induction rates. The CAR mortality rate is 882 per like 100,000 live of births, and usually malaria also usually occur under five people who are under 5 years child. So the birth rate was much more higher than other country. Here is the intervention for the malaria. We can establish a community health work network, and also we can introduce a rapid diagnosis test. Here's our action plan. We want to reduce malaria to 30% after 5 years, and also treatment for 90%. We use around like 8 million US dollar over the 5 years. We do like 5 year action plan. Yeah, here's our people we need. Yeah, that's the last one is HIV. Here's the HIV rates and how can we get the incidence rate of HIV. We use a new HIV to over the unaffected population times 1,000, and then we can get a number. Here's the intervention about malaria, and the first one we can do safe sex, and the second we can give them health education and counseling, and the last part is prevent the mother to child transmission. And here's our action plan about the HIV. We wanna reduce the incidence rate for 1%, and further to improve the sex rate of complete cure. Here's our key action. We do 5 years plan. And here is our partner. We need to collaborate with each other. And here's our reference list, and then thank you.